Health psychologists. What's a health psychologist? Health psychologists use their knowledge of psychology and health to promote well-being and understand physical illness. Health psychologists are specially trained to help people deal with the psychological and emotional aspects of health and illness, as well as supporting people who are chronically ill. Health psychologists promote healthier lifestyles and try to find ways to encourage people to improve their health. Health psychologists also use their skills to try to improve the healthcare system. We asked some health psychologists to share their experiences, and this is what they told us. What was your journey to becoming a health psychologist?
I worked in another profession part-time to fund all this. It was a career change. I was influenced by having a family member disadvantaged in their access to healthcare due to their mental health diagnosis. I wanted to ensure that others did not receive the same level of discrimination.
How does your work make a difference to people and the communities you serve?
I first learnt about health psychology after completing my psychology degree. It was a light bulb moment that seemed to cross my interests in physical and mental health. During my MSc in health psychology, I worked as an assistant alongside a health psychologist and then in an NHS health improvement team.
How does your work make a difference to the communities you serve?
Working in the NHS as a member of a multidisciplinary team, my work contributes to helping people live with persistent pain, learning how to live well in spite of their pain, and understanding what this means to them. Training and mentoring the next generation of health psychologists mean that they too will go on to make a difference to their communities.
What are the best and worst things about your working day?
The best is supporting people as part of the NHS, still a national treasure. The worst can be navigating the barriers to funding training and jobs for psychologists, in spite of how much they are needed in services.
What does diversity and inclusion mean to you?
My understanding of this changes as I learn more about perspectives and experiences other than mine. For me, it is about giving people the attention, help, and opportunities they need to give them an opportunity to succeed. It is about listening when someone highlights a barrier and then doing something about it. It should not be performative. It should be a behaviour. Words are great, action is better.
What advice would you give to someone considering working in your profession?
Do it, it's a pleasure. It takes a number of years to study, but the rewards are worth it. If you're interested and passionate about psychology career, go for it.
What are you most proud of in your work so far?
Often I am the only person in the room or round the table who is advocating for a psychological approach to physical health. In a world that is often still very biomedically focused, I am proud to advocate for the importance of health psychology and why there is a great need for more psychological input within both mental and physical health services in the NHS.
If you used a time machine and started again, what would you want to know about your career path?
I would tell myself not to worry so much about what jobs I would get after I qualify. I worried so much, and knowing what I know now, I didn't have to. I've had some brilliant jobs and amazing opportunities.
Want to know more about becoming a health psychologist? Go to ppn.nhs.uk/resources/careers-map.